Good afternoon, Brad Edwards here. Thank you for joining us on the stream. Important conversation we want to have today, this afternoon, on monkeypox. And we've seen the case numbers rapidly rise in the past few days. A lot of people have a lot of questions. We've been asking for your questions, and now we've brought in a top expert to answer some of those questions. Dr. Becky Smith. She's a professor at the University of Illinois, Urbana-Champaign, and she is a doctor of veterinary medicine, also has a PhD in epidemiology from Cornell University. Quite the resume, great CV, curriculum vitae, and kind of strikes directly at our discussion today, which is monkeypox, does it not?
Right. So we worry about monkeypox because it's a perfect example of something we call a zoonotic disease, which means that it spreads between humans and animals.
So, doctor, first question is how worried are you? Let's give it a 1 to 10 number. I know it's impossible to tell, but the way we've seen it spike in the past few weeks, we have now, 533 known cases in Illinois, known cases, 433 in Chicago. How worried are you?
Prior to the COVID pandemic, I wouldn't be worried at all because we know how to control this. But we've seen that knowing how to control isn't necessarily sufficient. So we have tests, but we don't have sufficient tests to get everybody tested who needs it. And we have vaccines, but there is a limited supply. So I am concerned that we're not getting ahead of this and that it could get a little bit further along into the population than we want before we really ramp up the supply of tests and vaccines.
Give me a time frame on that, if you could. How close are we to having at least the vaccine available to everyone, and even the testing? Some people who may think they have it can't even get a test to confirm that or not. It seems like we really are behind the 8 ball. How time frame for me? How far behind the 8 ball are we?
I'm not sure how long it will take to ramp up testing and vaccines. I know that the Biden administration has just named a director for the national monkeypox response, and I don't know how long it's going to take them to get everything moving and to speed things up. Right now, we've increased our number of tests, but they're still moving pretty slowly, and the vaccines we know are in extremely short supply at this point. The good thing is we have an approved vaccine, we just don't have a lot of it yet.
Yeah, and it's a proven vaccine. Who needs to be worried? What do you need to look out for? How do you protect yourself, sans, without a vaccine?
So at this point, the highest spread numbers have been observed among men who have sex with men. It's particularly been spreading within this network of individuals, which we know is a tight-knit group. So those are the people who are being prioritized for testing and for vaccination, and those are the people who need to take the most precautions and people who interact with them closely, mostly people who live with them. So the best way to protect yourself is to be sure that you're not putting yourself at risk, so don't put yourself in risky situations. Monkeypox, unlike COVID, is mostly not airborne. So it's not close casual contact that is a concern right now. It's close contact, sexual contact, living with people, sharing sheets, towels, clothing, other things that come into close contact with your body, such as sex toys. All of these things can carry the monkeypox virus, so we want to avoid sharing them. We also want to be careful about kissing and about sex. This is not a sexually transmitted disease, meaning that it doesn't require sex to be transmitted, but sex is a really great time for it to be transmitted. So we need to be careful about avoiding sex with people before you've talked to them about their health, and thinking about ways to be a little bit safer about our sexual activities just at this moment.
Okay, and I appreciate your honesty there. Of the 533 cases in Illinois, it's estimated 1% of those cases identify as straight. So that means 99% of those cases are happening in the non-straight community. In Chicago this weekend, we have one of our biggest festivals of the year. It's called North Halsted Market Days. 300,000 individuals that range in the queer spectrum. Would you go?
Well, I would make certain recommendations. Personally, I would not go, but that's because of COVID, not because of monkeypox. COVID is still circulating and it's still a risk, and I have a child who is awaiting that last little bit of time before fully vaccinated. But if you were to go, I recommend, first, if you feel sick, don't go, just in general. If you feel sick, don't go into festivals. Wear a mask for COVID, but for monkeypox, you want to avoid those close contacts. So avoid kissing a lot of people, and just avoid those close, especially the sexual contacts that we've been seeing, and those close bodily contacts. The CDC is recommending, if you're looking at a rave or a dance party, if people are mostly fully clothed, that should be okay. But if there's a lot of lack of clothing and rubbing up against people, that might be a concern. So it's okay to go, but you want to be cautious.
Okay, good answer there. And you said some things like drink sharing, so on and so forth, and roommate scenarios, like you really need to be in having these candid discussions when it comes to monkeypox, correct?
Right, and just being very cautious about hygiene. So washing sheets pre and post sex is highly recommended, and just washing your towels, washing anything else that comes into intimate contact with your body.
Is this a gay thing? Is this something we've seen pop up within the gay community? I mean, just look at the numbers, and there's no offense taken. You're speaking to a gay man here, but 99% of those who are afflicted with this right now are or identify somewhere in the queer spectrum. Is this an anomaly that it's come up now? Was there's something that you know that has happened, some mutation recently? Like, you know, we've all had a lot to deal with. I mean, COVID, the economy, the litany of things, and now this. Why?
As far as we know, there is nothing about homosexual interactions that make gay people more at risk for this disease. It's simply that it emerged in that community, and because that is a tight-knit community and a lot of people were traveling, that seemed to cause it to spread in that community. The other thing to remember is that with testing in short supply, early days testing, you had to be a gay man to get tested. So when we say that most of the people who have tested positive are gay men, that is, up until this point, that's most of who we've been testing. So we have seen it spilling over into other communities, primarily from people who live with gay men or who have extremely close contact with them, or other men who have sex with men, which, as you know, includes more than just gay men. So we know that it's been spreading mostly in that community, but that's not because of that community. It's just because it happens to be in that network.
Mm-hmm. We appreciate that insight. So let's talk about the incubation period. It can range. There are ranges out there. I'm talking from, you know, entities that gauge these things, government entities, think tanks, so on and so forth, that it can incubate. And I guess it means you're not going to show it for, some say 6 to 13 days, some say 5 to 21 days. You may have it in you and not know it. Which is, you know, kind of a scary thought. But the question is, for others who don't have it, is it transmissible? While it is incubating in one's body, can one transmit it to another?
The best evidence we have is that if you're not having symptoms, you're not likely to be highly infectious, so that you're not likely to transmit it to other people. Once you start to have symptoms, then you become infectious, and then contact with those pox marks or with other bodily fluids can become highly transmissible. Once you do start to show symptoms, you are transmissible, you are infectious, until those completely clear and new skin has grown over those pox marks, which can be 2 to 4 weeks. So you may not be infectious right away. You may have a little bit of time before you start to show signs and become infectious. But once you are infectious, it is a 2 to 4 week period before you start to clear up and are not infectious anymore.
In the most severe cases, how ill can one get?
There are deaths associated with monkeypox. Luckily, death is rare in the Western world, primarily because of nutrition and supportive care that is available in our hospital system. But there are deaths available. There is severe pain and itching. There is scarring is possible. So the concern is primarily that there is a risk of death, and then there is also just, it's a really nasty thing to have, and you can end up with flu-like symptoms, fatigue, headache, muscle aches. So it's not a fun disease to have, and there is always a slight risk of death.
Yeah, and it sounds, from what I've heard, even anecdotally, it can be a week's, even up to a month-long battle. When we talk about the lesions, and if you Google monkeypox lesions, there'll be these giant, almost boil-looking things. They don't necessarily, though, need to look like that, right? I mean, it can be small, almost like a pimple-looking blemish on the face or something like that, correct?
Correct. So it can range from very small pimple-like marks to the large marks. And people should be aware as well. I know there's been concern that people with other skin diseases have been targeted on public transport for you're out here spreading monkeypox. Remember that not every skin lesion is monkeypox, and skin lesions with monkeypox can vary from that very small to that very severe.
Governor J.B. Pritzker has announced he announced an outbreak, and has also, labeled it, stamped it a public health emergency in the state of Illinois. Do you think that was an appropriate action, premature, post-mature? Your thoughts?
I think it's a very appropriate action. I've been very impressed with Governor Pritzker's response to the public health emergencies we've had lately. By labeling it a public health emergency, the state gets to tap into a few more options for controlling. They can use the public health emergency management agencies to get vaccines out and to set up testing sites. So it gives them a little bit more capacity to respond. So I think that's a really great idea, just to give public health a few more tools.
And just getting a question in here now. There is a concern with school starting soon, and with kids coming back to school. Multiple pronged question here. We know kids come from the rainbow of families right now. Are kids getting it? Anecdotal evidence, what are we seeing? Are their immune systems stronger? What does the science show you when it comes to monkeypox and youth?
So we have seen pediatric cases. It's very small numbers compared to the number of adult cases at this point, but in the US we have had a few pediatric cases, and there are cases that came from families in which there were men who had sex with men. Kids are really great at spreading infectious disease, as anybody who has or has worked with kids know. So I am certainly concerned about the start of school, that with kids mixing, it is likely to be able to spread within the general population much more easily. So that is seriously a concern, and we want to be careful about that with schools starting up.
Okay, so you're laying it out straight here. This is a concern for basically everybody, but a concern for parents with kids going back to school. when we talk about the vaccine and if its efficacy, it is fairly, I believe, in the 98th percentile affected. Is that available right now? We know it's only available to a very select group, really probably the most at risk of men who have sex with men. Will it become widely available? How soon? And can anyone of any age take it?
So I know that right now it is limited to men who have sex with men who are over 18 years of age and who have had multiple sexual partners within the last 14 days. So that is a very limited group that has it available right now. As it becomes more widely available, I am sure the criteria for making it available will change. Right now, it's not needed by everybody. It is, as far as I know, quite safe for adults. I am not familiar with for children, whether it's safe for children, but because of the lack of supply, they really are limiting it. And in fact, in the state of Illinois, they are prioritizing first doses. This is a 2-dose vaccine, but they are prioritizing first doses, and they say we'll follow up with the second dose when supply increases.
So, I mean, a lot of the warning signs, you know, kissing, body contact, but then you talk about everything from sharing drinks to sharing sheets. So, I mean, this could be a real spreader, if you will. If you were in charge of Market Days, which is a boisterous, lively, one of the most popular festivals of the year here in Chicago, 300,000 expected to attend North Halstead this weekend. Should organizers think of canceling it?
I can understand that they would not want to. After the last couple of years we've had, people really want to get back to these cultural markers. I would encourage them to be very open, and I've seen that their website, they have monkeypox information right on the top of the website. That's great to have information out there just letting people know how they can protect themselves. Luckily, as I said, unlike COVID, this is not airborne. So it's much easier to protect yourself out in public by just avoiding certain high-risk activities. And I think that the festival, as long as they make that very clear to people, they put the information out there, I think that they can go ahead and enjoy some great outdoor activities.
Okay.
Outdoor, please.
Do it
COVID's still out
safely
there.
and no drink sharing. That's for sure. Another question we got from viewers is for businesses. Of course, businesses have been through the ringer over the past couple of years with COVID. If it's learned a business is a teammate who gets monkeypox, what mitigating factors then can be put in place to ensure further spread doesn't take place?
That is a very good question, and it's going to depend on which business. I know there has been concern about massage therapists, that because they have that close bodily connection with their clients, they need to be aware and they need to be prepared to take precautions, to wash hands, to wash sheets, make sure everything stays clean. For other businesses, unless your work involves that close contact, it's not a high risk for workplace associated transmission. So healthcare facilities know what they need to do, and massage therapists and others who have that close contact should be aware. But other businesses, I think, don't really need to be as concerned.
As discussions go, Doctor, you know, we know we'll be talking about COVID again in 2 months. We've been talking about it for years now. Governor's already declared a state of emergency when it comes to monkeypox. We know the most at risk for it are at least able to get, you know, some type of treatment, and we know there's growing awareness of it. Do you think we'll be having another discussion about monkeypox in a month or 2 months, or do you think it will be controlled?
I have hopes. For one thing, monkeypox is a DNA virus, unlike COVID, which is an RNA virus. And the great thing about DNA viruses is that they don't mutate quite as quickly. So it's unlikely to have all of these new variants and the new flavors of the week or of the month. And because it's not spread through air, because it requires that close contact, it's a little bit easier to control. So I think if we are careful, we can get ahead of this. We need to work fast.
Yeah, and it appears as slow as bureaucracy can sometimes work, it appears things are moving as fast as possible. Break that down for me again, because it's always interesting when we learn something, and we can learn something on the stream here. That's what we do, kind of extended things. Give me that RNA, DNA breakdown. So basically, this is your parents' monkeypox, if you would. This is monkeypox has been monkeypox has been monkeypox has been monkeypox. Give me that little explainer again for our science lesson of the day.
Sure. So when DNA copies itself, it's pretty good at making sure that it doesn't make mistakes. Mistakes happen, but they're very rare. RNA is a sloppy copier. So it makes a lot of mistakes when it copies, which allows for mutations to happen. So COVID is an RNA virus, which means it can have that sloppy copying, which means it has more mutations. Whereas with monkeypox, it's a DNA virus. It doesn't mutate as fast. And you need a lot of mutations to change the way a virus works, because most of those mutations don't actually help the virus at all. It's only the very rare ones that actually make it more infectious or more transmissible, more pathogenic, meaning it causes more illness. So those are rare. So you need a lot of those. COVID gets a lot of those because it makes mistakes all the time when it's copying. So it's making new mutations, trying new things out all the time. Monkeypox, not so much, so it doesn't change quite as quickly. So what we're seeing now is probably very similar to the monkeypox that we've dealt with before. The change is that it's found a niche, and we've been hearing about this for a while now. There are physicians in Nigeria that have been warning about the potential for spread through sexual networks for a while. So this has been going on for a while. It just happened to get into the right network at the right time when people are emerging from pandemic and wanting to interact again. So unlucky for us, but it's a little bit easier to control than COVID, which changes so quickly and which spreads through the air, so it's easier to spread through casual contact.
Important explainer there, and exactly the reason why you were the perfect person to have on the stream with us this afternoon. Dr. Smith, any final thoughts, final takeaways?
My general advice for anyone in this and every other outbreak, if you are sick, please stay home and be aware of what's going on. Wash hands, wear masks, take care of yourself, and take precautions, and try to stay safe out there.
Okay, and our same wishes for you down in Urbana-Champaign. Dr. Rebecca Smith, professor at the University of Illinois there, a doctor of veterinary medicine and a PhD in epidemiology from Cornell University, the perfect person to have on this afternoon, and we thank you for our time and your discussion, our discussion about monkeypox. Dr. Smith.
Thank you for having me on. It's been great to talk to you.
And thank you for streaming with us, everyone else. We appreciate your time. Now we'll go back to the stream.